So here are some essentials, some dental things, and some things I wouldn't dream leaving at home. So let's get into it. So let's get all of the tech out of the way. I have my AirPods in this really cute little milk cotton case, which, you know, obviously are really helpful. You can use whenever you're on the transport and stuff like that, or if, for example, my patient doesn't turn up, I have time to study and stuff like that. So I have my laptop as well, and I usually also have a notebook with me. This is the current one I'm reading. I went to BDSA, so the authors here were doing a like presentation as well, and it was so good, and it's really helpful, this book actually. Let me quickly show you. It shows you like flow charts of little things, like how to do like clinical stuff. So this is actually like really good clinically as well, and it goes through like all of the different scenarios and how to treat emergency patients and stuff like that. Really helpful, really expensive, but I think all of the money goes towards kids and charity and stuff like that. So it's a really good book. I think you should get. This also is not in a PDF form, so you have to actually buy the book, but I think it's completely worth it. And the last electrical thing is my charger, because I also have my laptop charger, but I'm using at the moment, so those I usually always keep with me just in case I need to charge any of these things if I have a free period or anything like that. The next things I carry with me are these notebooks. So the first one, obviously, this is the Clinical Handbook of Dentistry. This is the 7th edition, which came out last year. It's really helpful. A lot of people have like controversial thoughts about this because, you know, it doesn't really, like, it covers every single thing but in like a small detail, and I think it's really helpful if you want to quickly look up like a medication, or quickly look up like a disease or something like that, or like what to do in like this patient and stuff like that. I think it can be helpful, so I just keep it with me anyways. And if I have like an extra 5 minutes, I might like flip through it. The second thing is I have these two notebooks. So this is like my rough notebook, and this is my like real notebook. So this one I kind of like, obviously when you have a patient and stuff like that, or you're nursing or something, or the supervisor says something, you want to quickly write stuff down. Also sometimes like the patient is like, oh, can I have that written down on a note or something, so I usually just like rip out a sheet and give it to them. But this is also really helpful because I can have like things for, like, for example, if I know I'm like really stressed about a certain appointment, then I can quickly like jot down some notes just to like prompt me as I'm going through it. And it doesn't have to be like actual notes, it's just like just random stuff. Or if I need some paper to quickly write down, okay, like their dental history and their medical history, like important things, or if I'm, you know, getting a pain history or something like that, it's really helpful. Or if I have notes from a supervisor from a treatment that I did, they have some feedback for me, I write it down in here, and then eventually this goes into my laptop and my Notion page, which I have for like clinical dentistry. So that's really helpful, just to like write everything down. Also at the end of like my book, I have this thing which basically goes through every single date that I have, and then it goes through if I'm morning or afternoon dentist, and then it also goes through like, so I don't, obviously you have to have patient confidentiality, you can't actually write like the patient's name and stuff like that, but I kind of like have them like in my head. I have them, okay, patient 1, 2, 3, 4, and then I usually just have like, okay, so patient 3, I'm doing a lower left 6 restoration, blah blah blah, all of that stuff, what I'm doing for that appointment, how long that appointment is, and if I have any other appointments after that. That's really helpful because it just kind of keeps me on track on what I'm doing, and then I have that like going on and stuff. It also has like stuff like, you know, targets that I really need to meet and stuff like that, so that's really helpful. It's like a scrap notebook which I can just jot down things, and that's really good. But this bad boy is where everything's at. This is like the main, keeps all of the information that I need, like very important information, but also like, you know, step by step how to do any procedure at any time. So like if I need to do an RCT, it gives me a list of the instruments, step by step how to do them, as well as, you know, things like canal anatomy and stuff like that, depending on which tooth I'm doing, all of that stuff. That's really important. Common medications, common systemic diseases, common, it has all my targets in there. It gives me criteria for all of the exams I have to take, like clinical exams on my patients. So if a patient comes in an emergency and needs a RCT, I know exactly like what criteria comes under dental emergency exam, and I can complete that. But yeah, it's really helpful, I think, because the main thing is it has like this like binder kind of thing, so you can basically like put in and take out papers, and it's really helpful because, for example, if I have a list of instruments that I need my nurse to get, I can just rip out that, take out that page, give it to them, and then I'm sure that they have everything. I don't have to be like, okay, make sure you get this, make sure you get this, and then they can give me the paper back and I can put it back in here. I also have like a list of all the targets I have, so how many radiographs I need to get before I pass 5th year and stuff like that, and then like all of the criteria I need. And it's really good because they basically have these tabs, or well, I bought these dividers that are basically really good because on the tabs I have different names like perio or ortho or endo and stuff like that, so I can separate them depending on what speciality it is. And it's just been like such a lifesaver, because I think when you're organized and you have these things in place, you save a lot more time when you're actually there clinically. And with clinic, obviously you only have a specific amount of hours a week, and you want to make sure that you're making the most of it and you're quite efficient with your time. And I think this is really helpful. Another thing I think is also really helpful to save time, I know this is not the topic, but having like patient templates already made, so you can kind of copy and paste, and then your nurse can just fill in the details and you can check over it at the end. That's also a lifesaver. But moving on to things in the bag, I also have like a stack of pens. Usually whenever I'm studying, this is really helpful. These are the Zebra Sarasa clip ones. They're really nice. I wanted to try them out because I used to love the pellet juice ones, but these are quite good as well. I also have some hair ties, because you're not supposed to have your hair down, you're supposed to have it up and off your shoulders. You're also supposed to have nothing on your wrists and your nails cut short and stuff, so even nail polish remover is a good shout. I also have lens cleaner because I wear glasses, and if you wear loupes, this is something that you should carry as well. I got this from Sunglasses Hut. It's really, really good. And then obviously a pair of contacts just in case. I have a pair of scrubs, just some backups. I always carry like a million masks with me just in case. I also have things like paracetamol, hand sanitizer, and wipes. You could never go wrong with these. Just in case, like wipes if something spills in your bag, and obviously hand sanitizer, don't need to explain that. I also carry lip balm with me because I have like this feeling like if my lips are dry, like I can't like focus very well. It's really weird. But obviously because you're in a clinical setting and because you're touching loads of things, obviously you're washing your hands like regularly, but I prefer to have a stick one. This is just the Burt's Bees one, which I like. I also have some gum on me because if I'm the afternoon dentist, I would have had my lunch, and depending on what I'm eating, you want to have some mint, because you know, like, you can smell your patient's breath, they can probably smell yours. Yeah, don't know if I said paracetamol, but that's key, because you know, if you're working long hours and long days, probably didn't get some sleep if you were studying or something like that, you can be quite you can get migraines, and other people can get migraines as well, so it's just helpful to have. I also have perfume because you know, you want to make sure that you smell nice when you come to clinic, and I have this one. I'm not like crazy about the scent. It's the Honey Marc Jacobs one, but I like it because the lid stays on, and a lot of my perfumes just explode in my bag. It's just not a good situation, but it's nice. It's alright. I also have these things which are amazing. They're like little travel perfume things. So what you do is you get your perfume and you take the little spray nozzle off it, and then you get this, and then you like pump, and then it will fill up in here, and then that will be like a very a travel size little perfume, which is really nice. But yeah, that's not the same scent, so I don't want to mix up these scents. I also have a thermos because if I'm on a break, if on my lunch or something like that, it's nice to have like a nice little hot coffee with you. And obviously if I have a free period, no patient or turns up or something like that, I can have, you know, study with like some coffee, nice vibes. Always have hand cream on me. This is the Ted Baker's one. It smells so nice. I don't actually think this is the most moisturizing though, so I might swap this out for something else, because honestly you need hand cream because you're washing your hands so often that your hands are gonna be sick of it. So get some good hand cream, and yeah, make sure you use that. The other things I have on my IDs, so this is my university ID, which I need to swipe in and out of the building, and then this is my NHS ID, which you need like for certain areas and stuff like that. And then obviously I have my badge as well, which is very important because otherwise supervisors, you know, if you have different supervisors all the time, then it might be hard for them to like know your name, or even the patient and stuff like that, introducing yourself. So yeah. And I've talked about this before, but this is like a lifesaver. It basically is something that you use around your masks to basically have them like not on your ears, because obviously you loop these around your ears, right? If you have one of these, you just like tie it up. Let me show you. If you tie it around here and then go like this, it's basically tied around your head. And obviously I'd have my hair up so it wouldn't look this ridiculous, but basically you, because I'm wearing glasses and maybe you're wearing loupes, you're also going to be wearing a visor, all this PPE and stuff like that. It really weighs down on your head and your ears, and I found that at the start of second year, and especially when all of the COVID stuff was happening, when you were wearing even more PPE and protective equipment and stuff like that, I found like my ears like really like feeling really heavy, feeling red, and then I used to get migraines. So this has been a lifesaver, and I highly recommend you get one. You can get ones in different sizes depending on how loose you want it. Obviously the longer the looser the mask will be. But yeah, and the last thing that you cannot forget is having like a million pens, because you know, your supervisor will take it, your patient will take it, everyone will take your pen, but you need to make sure you have a pen there for them to sign consent, to sign different forms, to make notes, to like write down histories and stuff like that. So very important. I also have a pencil, and the colored pens would come in use if you were doing dental design, but most clinics usually have pens and stuff like that for you to use. But yeah, that's pretty much everything. But make sure that you subscribe so you don't miss out videos like me going through this book and showing you how I organize everything for clinics, and you know, being efficient with my time, everything from getting into dental school to life as a dental student, because I'm now a 4th year, as well as productivity tips and like a million other videos that you can check out on my channel. So make sure you check those out, subscribe so you don't miss another upload, and I will see you in the next one. Bye.